Hi, I'm Dr. Paul, again at Live on Purpose TV. Today we get to learn a little psychology. You ready for a psychology lesson? What's the difference between depression and sadness? As a clinical psychologist, I get a lot of questions about depression. One of the most common and commonly diagnosed conditions that we deal with in the field of psychology. And one of those questions has to do with sadness versus depression. What's the difference? I think to better educate ourselves on those lines, let's take a look at mood and what mood is. So on this graph, we will put at the top of this axis, manic. Some of you have heard that word. I'll describe a little bit more about what it means here in just a minute. Down here at the bottom, we will put depressed. And those are both words that describe mood. I'm not talking about a particular disorder right now. I'm talking simply about mood. Now, in the middle of this, if depression is at the bottom and mania is at the top, somewhere here in the middle of this range is what we might call, I'll give you the psychobabble word for it first, euthymic. Nobody uses that word. It's psychobabble. It means normal. This is the normal range of mood. So these would be the extreme ends, and this would be the normal range. Now, most people go through life having a normal mood. So some days they might be really up, and some days they might be really down. It might cycle a little bit, but basically they're going to stay in that normal range. Some peaks, some valleys, but it kind of returns to this normal range. Depression is a disorder of mood. And there's many different kinds of depression. Just as a quick overview, you might have a severe unipolar depression. That's when the mood is very depressed. Okay, down here. Now, I'm not talking sad. In fact, a lot of times sadness is confused with depression. Sadness is part of a normal mood cycle where there's a lowering of the mood. Depression is often more numbness. In fact, it's described that way very often. It's like there's a flattening or a deleting of mood because your mind and your brain have mechanisms built in to compensate for being in this range. So oftentimes it's more blunted or numb rather than sad. In a severe depression, the mood remains in this depressed state for a prolonged period of time. Now, there's also something that we might call bipolar depression. You're familiar with that term. It's actually a clinical diagnosis. The old term was manic depression. Okay, are those words sounding familiar from what we've talked about here? In a bipolar condition, we have the depressed mood usually for most of the time, and then there will occasionally be a spike up here, not to normal, but to the manic side. Now let's talk about mania for just a minute. This is not happiness any more than depression is sadness. It's an extreme end of an elevated mood. Another word for manic might be crazy. In fact, it looks crazy to people. I remember early in my career a young man who was going through a manic episode, and we found him at midnight in a tree with a guitar singing his lungs out. A little crazy, right? And it's because of this elevated mood. Some people, when they're in a manic state, will get very pressured speech, or they'll start engaging in activities that are very questionable judgment, like gambling or sexual promiscuity or something that they regret later on. So mania is not happiness any more than depression is sadness, okay? Happiness is part of a normal mood range. I'm talking extreme. In a bipolar depression, there's at least one manic episode and then usually a return or a crash back down here to the depression state. Bipolar, meaning that there's two ends to that spectrum, the mania and the depression. There's a lot of different kinds. We won't go into all of them, but I think you get a sense for what we're talking about with the mood spectrum here. Now, depression is a mental illness or a disorder. I also like to think of depression kind of as the fever of mental illness. You know, when you have a fever physically, that's not necessarily the problem. It's an indicator that there's a problem going on. And depression can be caused by circumstances in life, or depression can be caused by an imbalance of the chemistry in the brain. There are a lot of different causes. It can be caused by a belief. In fact, you know, the number one depressionogenic belief. Depressionogenic just means it causes depression. The number one depressionogenic belief is that my worth, my value can change. Wow, think about that. That changes the game a little bit in terms of how we're going to deal with it. The belief that my value can change, because then I'm constantly scrambling to try to do just that, to improve my own value. We'll talk about that in some other videos as well. One of the problems with depression is that when a person is experiencing depression, they are less likely than ever to do the things that are actually going to help. And so that's why it's important for all of us, as we notice our loved ones experiencing depression or possibly even clinically diagnosable with depression. There are things that we can do to help and support them. Let's talk about a few of the things that actually help with depression. And we're going to start very simple. I'm going to some research now that was done by Dr. Ed Hallowell at Harvard University. At least he's the one who presented this in a seminar that I attended once. He called it brain maintenance. Now this affects the chemistry of the brain, and it also follows certain already determined principles that we've shown through clinical experience and research to actually be helpful. Brain maintenance. Think of it as 4 steps. We're going to start with sleep. Get enough sleep. In another video in this series, we talked about sleep. You can find the link in the description down there. Sleep is an important way to monitor and adjust the chemistry in your own brain. And different sleep patterns help to reset or reboot certain things. So get enough sleep. Step number 2, regular exercise. Oh, you knew this one was coming, didn't you? Again, we've got a video on how to motivate yourself to exercise. We want to give you the full tool set here at Live on Purpose TV. Exercise has been shown through the clinical research to beat antidepressant medication in the clinical trials. Isn't that interesting? Now, it's hard to get yourself to do it when you're depressed, but the research is very conclusive about this. Physical exercise helps. Step number 3, diet. Now, I'm not a nutritionist. You can get that on other channels. What you put into your body matters. This is the fuel that drives the equipment. Some people erroneously make a distinction between your brain and your body. Folks, your brain is part of your body. In fact, it is the most vital organ in your body, and it's an energy hog. It consumes more energy than any other single organ in your body. So the fuel that you burn matters. Eat a balanced diet that has all of the proper nutrition to run your body. The most important part of that is your brain. Eat a balanced diet. The last one, step number 4, is solitude, prayer, meditation, centering, mindfulness. I'm throwing out a lot of words for you. Pick the one that suits you best. We've found that healthy brains have to have time where there is a clearing of the noise and the clutter and the thoughts. So prayer, meditation, mindfulness, those kinds of practices tend to increase the health of your brain. Brain maintenance, one of the most important things that you can do to take care of depression and to encourage other people that you love who might be experiencing depression. Now, a quick little thought about therapy, counseling, medication. There are professionals who are trained to deal with this very issue, and there's a variety of different approaches. Get connected with people who can help you. I remember one of my clients saying, well, I should just be able to do this myself. And I challenged him a little bit about that. I said, really? Yourself? Like, do you do anything yourself? And he looked a little confused. I said, like, getting dressed in the morning. Do you do that by yourself? He said, yeah, I dress myself. Really? With what? Clothing that you made? From fibers that you harvested? Okay, he rolled his eyes a little bit. Okay, I get it, Dr. Paul. Probably hundreds of people helped you to get dressed this morning. Can you sign your own name? Yeah, with what? A pencil that you crafted from materials that you harvested? I don't think so. Hundreds of people combined to help us and assist us in doing whatever it is. Let's get past the taboos of, oh, I should do it myself. I don't think I should need help. Whatever. Let's be humble enough that we can access the brilliance of professionals and others who have studied these very conditions and are in a position to help us. There are so many options.
We all have a whole spectrum and range of emotions. Hopefully that brought some light to the question of depression and what we can do about it. I'll see you tomorrow at Live on Purpose TV.